Welcome back to the Healthy Skin Coach Show. I'm your host, Takashi, helping you get clear skin and preaching to the world why food is the ultimate medicine. Today, I have a very special guest with me. Her name is Dr. Terry Wahls, and she was able to reverse the symptoms of multiple sclerosis by changing up her diet. And she wrote the book, The Wahls Protocol, which is a radical new way to treat all chronic autoimmune conditions using paleo principles. And she wants to help guide readers to reclaiming their own health. Thank you so much for joining me today.
Thank you for having me.
Let's begin with your background and how you first noticed your symptoms and how it affected your life.
Sure. So I'm a professor of medicine here at the University of Iowa. And now, in retrospect, my symptoms actually began during medical school back in 1980. I had some abnormal sensation across my face, and over time, this became more electrical, much more severe. About 7 years later, I had an episode of dim vision in my left eye. That came and went. I was seeing neurology, trying a variety of things to try and deal with the trigeminal neuralgia, none of which worked, because I would develop a drug rash. And so I just had to put up with this pain when they'd come. Then in 2000, I started getting weakness in my left leg and was evaluated and found to have lesions in my spinal cord and one small lesion in my brain. So I was diagnosed with multiple sclerosis. And being an academic type, I knew I wanted to treat my disease aggressively. So I sought out the best people in the country, took the newest drugs, and still I went steadily downhill. After 2 years, my neurology teams told me about the work of Lauren Cardane. I read his papers, his books, and decided, because I'd been a vegetarian for about 20 years, and after a lot of prayer and meditation, I went back to eating meat. But I continued to decline, and the following year I needed a tilt-recline wheelchair. At that point, it was clear that the best conventional medicine, the best drugs, the best people were not stopping my march towards a bedridden and quite possibly demented life. And so that's when I started reading the basic science, and I ultimately began experimenting on myself, at first with supplements. And that seemed to my decline. It helped my fatigue a little bit, and I was immensely grateful. But then I discovered the Institute for Functional Medicine. I took their course on neuroprotection. I had a longer list of supplements, and I was thrilled to be taking that. And I was thrilled that they were also talking about mitochondria and a lot of cellular biochemistry. And so I was intrigued. I added these extra supplements. Not a lot happened, but then I had a really big aha moment, which I'm sure will resonate with you, Takashi. I said, well, what if I redesign my paleo diet using what I learned from my reading of the basic science in functional medicine? And so now I had a very, very structured paleo diet, because before I just focused on what to not eat. Now I was very careful about what to eat, in addition to what to not eat. And the results were stunning, actually. Within 3 months, my pain from the trigeminal neuralgia is gone. My fatigue is gone. My brain fog is gone. And I can sit up again. And then, within 3 months, I'm able to walk using walking sticks around the hospital. And then in 6 months, I'm able to get on my bike for the first time in 6 years, and I pedal around the block. My son is crying, my daughter's crying, my wife is crying, I'm crying, because this feels so miraculous. And then in another 4 months, my wife signs us up for the Courage Ride. And this is an 18.5-mile bike ride. And once again, as I'm finishing that, my son is crying, my daughter's crying, my wife's crying, and I'm crying. Because again, this feels so miraculous. I was able to, in the span of a year, go from being unable to sit up to biking 18.5 miles. So of course, this radically changes how I think about disease. It radically changes the way my approach in my clinics, and it would ultimately change the way and the type of research that I do.
Wow. incredible story. And I reflect when I had severe eczema last year and I was debilitated in my bed, bleeding on my sheets. You could see the dry, big flakes of skin. And I was so tired of getting prescribed steroid cream after steroid cream. And I knew that wasn't the answer, that drugs and topicals were not the answer. And I also went through a phase of just researching the science behind nutrition and the gut and healthy skin. And I discovered that food is the ultimate medicine. And so,
or the ultimate poison, depending on the choices we make.
Yes. And what I found out was that sausage pizza was the initial cause of the flare-up because of the red meat, dairy, and gluten. So the trifecta of inflammatory foods for me. And then what actually was making me worse was tea. So I guess the tea leaves and the
Oh no, for you to
would-
give up tea? Like, oh my goodness, that must have been difficult.
So I was drinking tea thinking it was anti-inflammatory because the GCG particles inside, which is anti-inflammatory for most people. But for me, it was actually reactive and I was sensitive to it. So I was drinking 3 to 5 glasses every single day thinking it would help me. But my symptoms kept getting worse and worse and worse. And I was baffled. I didn't know what was going on. So until I found out that tea was actually causing me to get worse, I would have probably had eczema forever. So now that I understand my body and I understand that food is the ultimate medicine, then I just want to share this message with the world, just like yourself.
Oh, absolutely. Absolutely. You know, I am so grateful because, you know, in 2007, that summer, it was very clear I was on track to become bedridden. I was on track because I was now having brain fog to potentially become demented. And my trigeminal neuralgia was getting more and more severe. I had thought it was clear that my future was bedridden, demented, and quite possibly intractable pain. So when, you know, I figured out that diet and lifestyle could really control all of that for me, then I felt this moral obligation to tell the world, to write this book, and begin teaching the public how to use diet and lifestyle to improve the quality of their life and quite possibly reduce the need for prescription meds, reduce the dose, often simplifying their medical regimens, often getting off medication after medication, and sometimes even getting off all medications entirely, all by using diet and health behaviors.
Mm-hmm. And you said
it's radical.
And you said you were a vegetarian before the symptoms kind of came up. What foods would you contribute to when you added them into your diet? Helped you notice the biggest?
Well, you know, so a lot of people know that I'm very, very fond of the paleo diet, and I have to remind them that for me, the paleo diet was not enough to recover me. So in 2002, I gave up all grain, all legumes, all dairy, meticulously, and put meat back in the diet. I had to do that over several months because it was a big change. But I continued to decline. And then I'm adding vitamins and supplements. I'm still declining, although more slowly. It wasn't until December 26th was when I had reorganized my paleo diet in this very specific way. I reduced the meat. I added liver once a week, and I dramatically increased my vegetables, particularly greens, green salads, kale salads, parsley, cilantro, cooked greens. I was usually having 3 to 6 cups of greens every day, 3 cups of cabbage, onion, mushroom family vegetables every day, and 3 cups of really deeply colored things, beets, carrots, berries. I added fermented foods, nutritional yeast, seaweed, and it was startling. You know, I'm beginning to recover. I recovered enough that I'm deciding to go to medical meetings and present my research. And what I discover is when I travel and I can't eat the volume of vegetables that I'm used to eating, after about 24 hours, my energy begins to plummet. So I would learn to travel with cabbage in my luggage, so I could have my volume of vegetables with me. And I would travel with kale because that travels pretty well as well. And so I learned how to travel and maintain my diet. It's actually gotten quite a bit easier now. But the biggest thing is I've learned to travel with my food, with my backup food.
Yeah, kale is one of my favorite foods, so I eat it almost every day. And I was wondering,
Yeah.
uh, do you incorporate omega-3s into your diet?
Yes. Yes. So I work hard at getting grass-fed, grass-finished meats. We add some wild fish as well. And then I talk about the benefits of taking fish oil or cod liver oil. And for my vegetarian, vegan patients, and I am mindful that people are vegetarian for very important spiritual beliefs, and we're going to work with them in terms of how to implement that diet in the safest way possible. So we have plans for vegetarians, and I'm mindful that even in the meat eaters, people may have religious reasons why they're avoiding beef or pork or other, culturally appropriate or inappropriate meats for their culture in their religious perspectives.
Mhm.
So we definitely work with people to be sure that we're paying attention to their spiritual needs as well.
Yeah, right now I'm just fascinated by researching inflammatory biomarkers like leukotrienes and prostaglandins, and how the EPA in fish oil can downregulate arachidonic acid, which can
Yes.
downregulate uh, leukotrienes
I-
and
You know,
prostaglandins.
it normalizes things very nicely. And my vegetarian colleagues would say, well, chia seeds have more omega-3s than salmon, which is true. But if you and I are eating the chia seed or flax oil or hemp oil or walnut oil, our body has to add another carbon chain, lengthen that chain to make eicosapentaenoic acid and docosahexaenoic acid that our brain needs and our cells need, so that as a man, you can convert about 5% of the vegetarian version of omega-3. If I'm pregnant, I can convert about 7 to 10%. Otherwise, I too am about 5%. So uh, if people are open to eating meat, having grass-fed, grass-finished meat, or taking fish oil, cod liver oil is superior. If they're not open to eating meat, then you could get either algae-based DHA oil, or you have to consume an even higher level of the vegetarian vegan omega-3 flax oil, hemp oil. So it's possible, but we have to be more mindful that we have to be much more focused on getting enough omega-3s.
Yeah, I mean, probably 90% of America just are deficient in omega-3,
Yes,
and they're
yes,
not
absolutely.
getting enough from food, and they certainly aren't taking the proper supplements. And
Correct.
the ratio, I don't, I think I heard that the average ratio is like 20 omega-6s, which is the bad fats, to one
Correct.
omega-3. And that's
And
the average.
sometimes as high as 45.
That's
And
crazy.
so when you're that off kilter, the ratios in our cell membranes affect the ratios in our brain. And so it affects our neurotransmitters, adding to problems with anxiety, with attention, with mood, with memory. So it's important to get plenty of omega-3s, but of course it's in balance. We want omega-3s. We want the omega-6s to be much more appropriately balanced, like 3 to 1, 4 to 1 is most ideal. When you are 15 to 1, 20 to 1, 45 to 1, in terms of the omega-6s to omega-1s, that creates a big problem. Every now and then you can find someone who is very careful to eat 0 nuts and seeds, takes additional fish oil, and so they skew the ratios too strongly to the omega-3s, and that can create some problems as well. So we can't make a mix omega-6 fats. We can't make omega-3 fats. our brain needs those fats, and we prefer to have them in closer to a 1-to-1 ratio.
Yeah, and I'm trying to optimize my body as much as possible. So I'm trying to get that 1-to-1 ratio, and
Yeah.
I'll take the fish oil pills whenever I eat, chicken or eggs or almonds, and to balance out that ratio. And when I was flaring up with eczema, I was eating like a huge bag of almonds because it helps diversify the gut microbiome and it's great at reducing inflammation. But it had too much omega-6s. Like it was like the ratio was like 12-to-1. And I would have like these giant 4-pound bags because it's such a tasty snack.
Well, they're very yummy.
Yeah.
They're certainly very yummy.
And my ratio was way off and I didn't realize that. So so now I incorporate fish oil, and a lot of people out there also are buying the wrong fish oil supplements, and sometimes they'll buy flaxseed oil because they read the marketing and they see it has omega-3s in it. Well, it has the alpha linoleic acid, which has to be converted to EPA and DHA. And the conversion rate is pretty low. It's
correct. 5%. So 5% for men. If you're pregnant female, you might get up to 7 to 10%. But if you're not pregnant or you're a man, then it's going to be that 5% range. So I have to eat 20 times the amount of vegetarian sources of omega-3s that I'd have to eat if I was eating a animal source, such as wild fish, grass-fed finished meats.
Mm-hmm. And back when I wasn't educated on fish oil and omega-3s, I bought this giant thing of flaxseed oil. But then when I look at the ingredients, there's actually more omega-6s inside if you consider the conversion rate from alpha linoleic acid to EPA and DHA. So these companies, love, marketing to people that it has omega-3s in it, but most people don't realize that they're buying the wrong supplement.
That they're also getting omega-6,
Yeah. What are some of the biggest misconceptions that your clients or other doctors run into?
Yeah, so sometimes, several. One is that you can't do the Wahls Protocol as a vegetarian. You can. I do have a vegetarian plan to make it easier for people who are vegetarian to do it more successfully. So we talk with them about how to structure their diet and how to supplement appropriately if you're vegetarian. Another mistake people think is that the Wahls diet is just, they could just do the paleo diet and get the same benefit. And I have to remind everyone that I did the paleo diet very carefully, very meticulously, but I continued to go downhill. Then I added supplements, based on my basic science reading that were for my brain, my mitochondria. And I continued to go downhill. It really wasn't until I redesigned the paleo diet in a specific way that I had this stunning recovery of function. So the magic is in the food, that we spent a lot of time into identifying nutrients that were really important for my brain, my mitochondria, my spinal cord. And then once we had that worked out, then it was months more figuring out where they were in the food supply. So that's why I came up with the greens, the cabbage, the onion, mushrooms, the color, why I recommend liver once a week. Why I talk about seaweed, the benefits of nutritional yeast, because they all have a very synergistic contribution to overall health and to neuronal health. So it's the precision of getting the diversity in the diet. I talk about the goal of 200 different plant species in a year, and that we can do that with spices, with teas, with vegetables. And I talk about this as a family activity, that this is a great way to get your children on board with it, to get your spouse on board, to make it sort of game night by keeping track of your plant species and diversity so that you can make your progress. Another thing that people may be confused about is that it's really expensive to do this, that you have to have a whole food store nearby, that only people with a lot of money can implement these concepts. And what I point out is my clinical time was at the Veteran Affairs Hospital here in Iowa.
Hmm.
And we created a lifestyle clinic that utilized my concepts in that clinic. And we were taking care of people living on food stamps. We were taking care of people on fixed incomes who really did not have much money. But we taught them how to write out menus, make shopping lists, how to shop, how to cook. We taught them, the fine art of improvising a recipe. That a recipe is simply a suggestion. There's nothing magic. Particularly now, as with all having to face the COVID, and you can't get to the store as easily. I'm pointing out to my tribe that you start with the recipe, then you go to your cupboard, your refrigerator, your freezer, you see what you have on hand. And if you're missing a few ingredients, okay, so what? You can improvise with other ingredients that you have. And that the recipe is simply a template, a springboard for the ideas.
Hmm. I help my clients also tailor their diet. And for me, I have the anti-inflammatory diet where everything you eat will increase inflammation or decrease inflammation. And there are certain inflammatory biomarkers that I look at, including cytokines and prostaglandins and leukotrienes. And that's been helpful in helping them clear up their skin, as well as helping them, live a more fulfilling and longer life.
Right. I'm sure it's helping many metabolic processes for them. And one of the things I talk about is that we're all unique because we have a unique set of genes from our parents. We have a unique microbiome that we've accumulated over our lifetime that helps us digest our food and make smaller molecules that will get into our bloodstream and help us run the chemistry of life. So you and I'm going to predict that we have a fairly similar approach, that we have a favorite diet that we start people on, and then we see how it goes. And I may adjust that based on my interview and exam of the person, so I know that they need a stricter diet or a looser diet. We start them on the program. I may check some really basic labs, see how things are going. We check in to see how they're feeling. And I would say 80% of my folks, the first diet we start on works for them. We've transformed their life, and we don't have to make any other big changes. But 20%, we aren't getting quite the results that I'm looking for or that they're looking for. And we continue to make adjustments to the diet based either on their symptoms, and we're doing the elimination diet, or I may do more sophisticated testing to identify which foods may be a problem for them, which metabolic pathways that they have more difficulty with and need perhaps some more greater nudging with the fish oil, or more specific nutraceuticals, supplements, herbs, vitamins to get their chemistry to be optimally tuned. So because there's no diet that is perfect for everyone, unless the goal is trying to kill someone. You could probably get one diet that would uniformly do that. But if we want to have optimal health, then we're going to have to listen to that person, their story, their health exposures, start with a diet that we think they would probably do well with, and assess their response and make adjustments based on their response or their lab testing.
Yeah, definitely. Yeah, my clients tend to have skin issues because I'm the healthy skin coach, and a lot of my clients are young teens with severe psoriasis or severe acne, and they write to me that they're suicidal because their skin is everything, and they can't go on life, and it's really sad to see. And then when I hear about their diet, it's just the most inflammatory foods you can think of, and I'm always motivated to help them change
what is
their diet.
striking is how little training most physicians receive in terms of the connection between the food we eat, how we run the chemistry of life in our cells, how inflamed I am at a cellular level or not. There are more young medical students that are much more curious about diet in biochemistry and immune cell function. And so we're finally now raising a crop of young medical students that are much more excited about diet and health behaviors. I'd say most of the functional medicine docs got into functional medicine through a path somewhat like mine, that we had some health challenge, either ourselves or a family member, that the conventional medicine did not resolve. And we were concerned enough, restless enough, that we kept reading, studying, and along the way discovered functional medicine, or perhaps integrative medicine, healed ourselves or a family member. And of course, the light bulb went off for us, and we're like, okay, I see the world differently now. And we end up changing how we practice medicine, and we change the way we interact with our patients, with our clients. And many of us begin to also teach the public as well, because I only have a couple thousand patients directly that I take care of, but with my TED Talk, I've got I think 3.5 million people that I've touched with my story, and recalling how transformed my life was by changing what I ate.
Definitely. And I joke that family doctors and dermatologists slept through nutrition class in med school, and
well, I've never even got one. It's
yeah, which is crazy, because food is the fuel source of the body, and you would think that people would connect food with as the ultimate medicine for your body, but
well, my daughter's taking chemistry in college, and she has heard me talk about food as medicine for a long time. She goes, Mom, this just makes so much sense as you study chemistry, that of course food is medicine, because we use the food we eat to run the chemistry of life. And I'm like, yes. So I'm having so much fun talking to my daughter about chemistry and chemical processes, and how that impacts our health. And of course, how the root of all our chemistry is the food that we eat or fail to eat.
Yeah. And every one of my videos and podcasts, I always say food is the ultimate medicine. I can't stress that enough to people.
Yes, food is our ultimate medicine, or it is our slowest form of poison. Now, in my case, if I accidentally was exposed to gluten, the protein in wheat, rye, barley, many ancient grains, or casein, the protein in dairy, or eggs, my face pain would turn up. About 6 to 24 hours, I'd start getting abnormal sensation across my temple and cheek area. And then it's followed with electrical jolts of very intense, unpleasant pain. If I do nothing further, within another 24 hours, will become so severe that it's difficult to walk, talk, or function.
Wow.
So now, and I'd suffered with that for 27 years before I pieced together how to create the Wahls diet. Now, interestingly enough, I view my face pain as this tremendous gift, because if my sensation of my face begins to deteriorate and I begin to have this face pain, I sit back, check in with my family, like, okay, what were the environmental exposures? What do we think the trigger was? Where could I have gotten the contaminated food? Did I have too much stress? What's going on? And what could I improve on? So that's allowed me to steadily, over time, do a better job of self-care. And it also has made it quite possible for me to look at, food that's quite delicious. And I know it has, gluten, dairy, or eggs. I'm like, it's just not worth the amount of pain that I would endure if I had that delicious food.
Yep. And I have that same mentality. Okay, if I eat that in 3 or 4 days, I'll have eczema. And since skin renews itself once a month, it'll take me a month or longer to heal. So it's just not worth it for my body.
It's not worth it. Yeah. So when I'm teaching patients and when I'm teaching physicians and other healthcare practitioners how to use the Wahls Protocol, we go through teaching the Wahls behavior change model, because getting people to give up today's pleasures with the foods that they're eating and their other addictive stuff that we all are addicted to, it can be a very challenging process. But one of the steps I have in there is teaching people about biosensors, that most of us have them. And if you're lucky, you have a pain biosensor, because that's harder to ignore, or you have something you can see, like your skin, or it affects your eyes and it changes how you see. when that begins to not work well, then I want people to sit back and reflect on what might have the trigger been, what might have precipitated this flare of my biosensor, or have I sort of slacked off on my self-care in some way that I could really improve on. Yeah, and once I get people trained on their biosensor, then they're really empowered to learn in a very profound way how I take better and better care of myself. You know, how do I steadily improve my diet? How do I steadily improve my stress reducing practices, my exercise, my social network, my self-talk? And so that's a really big step that we spend a lot of time training people on, and we spend a lot of time training our practitioners on. So we can empower our patients to tune in to their biosensor.
Mm-hmm. Definitely. What is your main source of protein, since you don't really eat eggs or?
Yeah, so I will have some nuts, soaked activated nuts. I will also have meat, fish, poultry. Tonight, for example, we're going to have some pork brats, and we're going to have lots of sauerkraut. I have some mushrooms, onions, and peppers that will be part of what we're going to have in that skillet. And I will make a phosphatidylcholine pudding that has PC, some omega-3s in it, some omega-6s, and a bunch of extra fiber, and a bunch of aronia berries, which are a really deep black berry, sort of like a cranberry, but black instead of red. And then I'll have some coconut milk kefir that's really quite yummy.
Mm-hmm, mm-hmm. Yeah, bone broth is a great way to heal a leaky gut.
Yes.
Yeah. Do you run into patients with leaky gut?
Oh, I assume everyone that I see has a leaky gut. You know, I think Alessio Fasano, I just wrote another paper on all disease begins with leaky gut. That certainly autoimmune conditions, that's one of the first steps, is that increased intestinal permeability, that leaky gut, which lets proteins get into your bloodstream before they were fully digested. And so that's how we can begin to get food sensitivities to these proteins that if we had a healthy gut would be completely digested before down to amino acids before they get into our bloodstream. If they get into our bloodstream without being digested, my immune cells will say, oh, wait a minute, you're too big. You must not be a normal compound that I should see in the bloodstream. So they'll begin to react, start making antibodies. They'll start activating the innate immune cells, have these inflammatory cytokines, which lead to achiness, fatigue, headache. You can have mental health issues with anxiety, depression, lack of focus. And all of that begins really with a leaky gut. And that can begin with a terrible diet, lots of sugar, antibiotics, aspirin, alcohol. So there are a lot of reasons why we could start down that path.
What is some advice that you can give up and coming medical students?
Oh, yeah. Well, learn about health behaviors. And I want to be sure that you're adopting these health behaviors yourself, because your patients will understand when you're speaking from experience, if you're speaking from book knowledge. And they care much more about your experience with food, your experience with self-care. And so if you learn how to get more vegetables and a healthier diet into your life now, you'll be very comfortable talking about your experience, and that will resonate deeply with your patients. If you learn how to meditate, how to maintain some physical activity levels, and you can talk about it from your experience, you'll be vastly more effective. Plus, it will get you through medical school much more effectively. It will get you through residency much more effectively. Because if we aren't taking care, if you aren't doing good self-care, medical school, all the rigors of medical school, residency, are very inflammatory. And they will set you up for developing your own chronic disease. And I'd rather you not have to experience that.
Yeah, and could you talk about how stress can cause chronic inflammation inside the body?
Yeah, well, so medical students have a lot of reasons why we get into trouble. We often get vitamin D depleted because we're inside. We have our sleep disrupted because of the call. And so if your sleep is disrupted, your cortisol levels go up, and your cortisol, once that goes up, that drives up my blood sugar. It increases my inflammation molecules, my cytokines, that will then lead to more central obesity, stiffer blood vessels, high blood pressure, higher rates of mental health issues. My microglia will be activated, and so I'll be more likely to have anxiety, depression, difficulty with attention. It starts a feed-forward negative feedback loop that will steadily decline your health. So, a meditative practice, a gratitude practice can be very, very helpful. Mm-hmm. And sleep is tough, particularly for residents and shift workers who have to go back and forth between daytime hours and nighttime hours. Mm-hmm. That's very tough.
Yeah. And do you have any thoughts on the Wim Hof method, where his breathing technique?
Oh, yeah.
His breathing.
I have a lot of thoughts of that.
Oh, go ahead.
So this comes down to hormesis. Hormesis, if you have mild stress followed by a rest and recovery period, that is physiologic. That is what our ancestors did for thousands of generations, millions of generations. We had to work hard to get our food, then we could have our food. We had a couple days to eat, recover, rest, relax. Then we repeat that cycle. As our body grows, we have to our jaws develop in response to chewing. Our bones develop in response to gravity. Our brains develop in response to the stress of learning, of paying attention to our environment. As we made our environments more and more comfortable for us through our cultural adaptations, and we started wearing clothes where we have a more narrow temperature range. And then we made buildings. We had a more narrow temperature range. Then we made fireplaces, and we had a more narrow temperature range. And then we made air conditioning, and we got more and more narrow. We lack that heat stress, which decreases our the efficiency of many of our chemical processes. What Wim Hof observed was that if he reintroduced that cold stress, he could have all these really very favorable shifts in how we run the chemistry of life. And it could lower our cytokines. It could normalize many of our hormonal imbalances. And so he coupled that with his meditative practice, his breathing techniques. And he's now able to show that he can take people in a 2-week training period and get them to achieve similar remarkable transformations and control of their physiology using this his cold water training. So I've never had the opportunity to work with Wim Hof, but I certainly am familiar with his work. I have done cold training, based on my readings of his work, and so I have a practice of cold showers, cold baths, ice baths, and it certainly will reduce your many inflammatory markers. People may be aware that there are cryo chambers where you can step into a chamber of cold, dry air for 2.5 minutes. That also lowers your inflammatory cytokines. A lot more study of that in Europe and in Asia. So cold therapy, likewise hot therapy, can be very useful. And I advise my followers to try and expand their range of temperatures that they can live with. It's helpful to expand your tolerance for heat. It's helpful to expand your tolerance for cold. We have to do it, train into this, because I don't want people to die of hypothermia, and I don't want them to get into trouble with hyperthermia. Heat intolerance can be a big problem for those with neurologic disorders, so we have to gradually train into that and gradually recover them. But there's tremendous benefit for having a tolerance, so you can include cold and heat training in your hormesis work.
Mm-hmm. Yeah, and I do the breathing techniques every morning, and I do cold showers, and I take saunas after the working out at the gym. So I do a lot of hormetic, activities in order to strengthen my body. And someone else who talks a lot about hormesis is Professor David Sinclair at Harvard. Do you follow any of
Yes.
his work?
I am not as familiar with his work, no.
Okay, but he's one of the leading anti-aging scientists in the world.
So if he's been writing, so I've been reading papers about hormesis, and so it's quite possible I've been reading his work. I confess I can't always recall the author for all the papers that I'm reading.
Sure. He talks about you want to activate the longevity genes called
Yes,
sirtuins, and how resveratrol is one factor, and metformin, a diabetic drug, can
can
also
do that.
activate the longevity genes. So, yeah, his work is fascinating.
In all of those, I talk about that, the Wahls Protocol, the various interventions that people do in terms of diet, and the health behaviors I talk about. All of these are speaking to these longevity genes. And many of them will also speak to your stem cells. Because for many of us, if you're following the standard American diet, the standard American lifestyle, we're speaking to our stem cells, but we're speaking to them in a very negative way. We're treating them off early. We're making the stem cells age early. And so we are aging very rapidly as a society. And people are thinking like, that at age 30, maybe men are supposed to quit having morning erections, that maybe we're supposed to be exhausted mid-morning by the age of 35, that we're supposed to be not that interested in romantic relations with our spouse. That is just not so. We're supposed to have a healthy energy, healthy energetic body, a healthy libido into our 60s, 70s, 80s. We should be able to be very, very functional. And it should not be until your 90s or 100 when our body begins to fall apart. And there's actually reason to think that if we do a really nice job with our diet and health behaviors, that we could in fact live well and functioning well and playing with your grandkids and your great grandkids at 100, 110, 120. And that's certainly my goal. I plan on playing soccer with my kids and their children and their children's children into my 80s, 90s, 100 plus.
Yeah.
But I'm making choices now very intentionally to make it more likely that I can do that.
Yeah, and I'm trying to help everyone optimize their health starting today. There's no
Yes,
time to waste.
no
And
time to,
yeah,
absolutely.
no time to waste, because I was debilitated from eczema, and that blindsided me.
Well,
And now I'm super focused on optimizing my health. And it's crazy that most people just neglect their health, and they'll eat anything and it
well,
won't work out, and it's
you
crazy.
know, but I'll give you a hint. Biologically, we're wired to crave sugar, salt, fat, inactivity, and pleasure. And so our ancestors, over thousands and millions of generations, were wired to do all of those things. And now we developed products that do all those things for us more conveniently. And so we have these amazing, yummy foods that are very addictive, amazing, fun games that are very addictive, amazing, comfortable furniture and spaces to live in. They're also very addictive. And to get us to give up that pleasure, that's a very difficult ask. So that's part of why in my book I talk a lot about the science of behavior change, because most of us don't value our health until it's gone. We don't value our money until it's gone. We don't value the people around us until we've lost someone really important. And then we get that wake up call, like now we begin to take a different view of life and begin to make changes. So you were destined to be just like everyone else, eating terrible food until you got the wake up call that your skin was suffering. And I got the wake up call, and I'm embarrassed to say it took me 27 years to figure out what the message was to get my life in order. But actually, I'm mindful that for most of our society, people are doing what makes sense for them. They're craving salt, sugar, comfort. And until they get a wake up call and have someone help them link their suffering with their diet and lifestyle choices, they don't know. But hopefully, thanks to your podcast and all of your work and the work I'm doing, more people are learning that all their suffering is more connected to their choices than they realize, and that different choices could make a profound difference for them.
Mm-hmm.
So what you're doing is just so wonderful that you're reaching out and helping so many people. This is such an important time. I also wanted to throw out there, because so many people we're all thinking about COVID-19, or at least the old folks like me, we're all thinking about COVID-19. The young people, I think, are coming around to thinking more about it as well. The same concepts that I'm teaching, that you're teaching, also help normalize our immune cells, help us more appropriately respond and fight off the infections, more appropriately, fight the infection off effectively. And then when you've got the infection defeated, you need to quickly turn everything back down to normal. And if your immune cells all screwed up because you have a leaky gut, you have a high NF-kappa B, you're at bigger risk to have that overactive cytokine storm. So if in my tribe, or the autoimmune folks, I'm talking a lot about the importance of diet and lifestyle to reduce your risk of COVID. And that if you're on the disease-modifying drugs, you got to stay on them while you're working on diet and lifestyle, so you could wean and transition to a steadily less potent immune modulating drug, and hopefully have diet and lifestyle ultimately be your disease modifying treatment.
Mm-hmm. Yeah. And a lot of people who are dying from COVID are obese or diabetic. And those are
obese, diabetic, smokers.
Yeah. And those are totally preventable conditions. And yeah, it inspires me to create content every single day to help everyone.
Yeah. We want them to know.
Yeah.
We want them to know. And if you have health coaches, health practitioners in your tribe, have them come over and check out the program that we have to train practitioners on how to use the health behavior change model, because it's challenging to help people go through letting go of our addictions. So we would love to offer more support if people are struggling with that.
Mm-hmm. I want to share a very interesting story. My friend suffered from severe ulcerative colitis, and he only had two options left. Either one, have surgery to remove his colon, or two, find an alternative solution. And he searched and found a doctor who told him that he had built up cortisol in his body, causing chronic inflammation, and psychedelics was one option for him. And so he took a therapeutic dose of 5-MeO-DMT, and it was able to cure his symptoms. And now he goes around preaching the benefits of psychedelics. So I was wondering what your thoughts are on psychedelics.
I have no experience, so I can't comment. I'm aware that there's some interesting research on these psychedelic mushrooms and some serious mental health issues. I'm not aware of the research on these mushrooms and autoimmune conditions. So I can't comment, but that is certainly a very interesting story.
Mm-hmm. Yeah. I have to ask, on the wall behind you, you have a lot
of poops.
A lot of poop emoji dolls and plushies. Could you explain the story behind that?
Well, I talk a lot about how critical our microbiome is to how we run the chemistry of life. And so my patients know that I stress that we are an ecosystem and that we rely on our gut and our microbiome. So they give me poop soap, poop socks, poop pillows, poop hats. So we have several hats. We have some rainbow hats, traditional brown hats, and many different poop emojis. And that's not my whole collection.
Awesome. Yeah, this has been amazing. Where can the viewers and the listeners find you?
So please come to terrywahls.com, Terry, Wahls, WAHLS.com. I am in the process of recruiting for a new study. So if you were newly diagnosed with multiple sclerosis or clinically isolated syndrome, please reach out to the study team at msdietstudy@healthcare.com. healthcare.uiowa.edu. Again, that's MS Diet Study at healthcare.uiowa.edu. And we'll tell you where we're at with the recruiting process, and we can find out if you're eligible. Follow me on Instagram at Dr. Terry Wahls, that's DrTerry, Wahls, Wahls, and Facebook and Twitter at Terry Wahls. You'll get to see what I'm eating. We have short videos talking about food, and we have short inspirational videos to get you through these challenging times.
To the trillions and trillions of listeners and viewers out there, please add her on all the social medias. All right. Thank you so much for joining the podcast, Dr. Wahls.
Thank you.
All right. Stay safe and stay healthy. Taco is out.